Hello everyone, welcome back to the channel and welcome to the video. My name is Steven and I am a third year dental student. One of my most popular videos that I've made on this channel was my how to survive your first year of dental school video. That video has done really well over the years, and I think it's just because people want to know more about the dental school experience and they want to come in a little bit more prepared. I am a few days away from the end of my first semester of D3 year, and this has been the biggest change that I've experienced throughout my entire time in dental school. Entering the clinic has been a whole lot. So I've been thinking about this for a while, and I wanted to make a video about the entire process in clinic, everything I've learned so far, and we'll go with the tentative title of How to Survive Clinic in Dental School. So there is a lot I want to talk about in this video in terms of surviving clinic and getting through successfully. I have a bunch of notes written down of just things that I want to guide me through the video. If you have absolutely any questions about clinic or dental school in general, please leave them in the comments below. The comments on my YouTube videos are the most likely place where I'll be able to connect with you and respond to your questions and comments. That's the best place for me. So hit the comments down below if you have any sort of questions. And of course, subscribe if you want to keep watching these videos and you're interested in dental school content. Let's go. So how to survive clinic in dental school. Obviously, I am nowhere near the end of my clinic experience. It's a 2-year process for us here in the United States. We spend 2 years in the clinic treating patients before we graduate, we get our license, and we go out and practice dentistry. So I am basically a semester in now, and just in this semester, I have gone from someone who knew virtually nothing about the process and who was absolutely blown away by how much was going on to someone who feels like they have a pretty decent grip on things and is heading in the right direction. The first thing I want to talk about is very, very important. It's actually essential, and that is organization. If you're not organized when you get into the clinic, I think that right there could chew you up more than really anything else. It's one thing to not be as organized for school because you have lectures, you have labs, and it's okay if you're kind of like going by week to week and you're not super organized with your schedule or with your assignments. You can kind of get by. But when it comes to the clinic, it is impossible to get by for multiple reasons if you're not very, very organized. And this is something that has been evolving for me. It's something I've been working on throughout the entire semester, just figuring out exactly what I need to be successful and how I need to keep everything organized so that at the end of the day, I get everything done, I treat my patients the right way, and I'm successful in clinic. So the first part of organization is appointments. Now, when it comes to the clinic, unless you're in a school that is entirely different from what ours is, you schedule all of your own appointments with your patients based on what your patients need and based on the requirements that you have to graduate. So essentially, you learn how to become a front office person of a dental office. You learn how to schedule appointments with your patients. You learn how to slot people in throughout the week, and it's entirely up to you to keep all of this information about your appointments organized. This right here is my little green book, and this has been my key to success this semester in terms of organization. All of my appointments and all of the pertinent information I need to know about those appointments is found right here. Basically, at the beginning of the semester, I had to figure out how to balance the multiple schedules that we were given. And the first of those schedules is, of course, the master schedule, which has lectures, labs, and clinic time all kind of laid out. So I actually made a video about this very recently, just talking about the schedule of a third-year dental student, and I broke our schedule down, the actual schedule that we've had this semester. So if you're interested in seeing that, check that out right here. But the master schedule is all of that information. It is week to week what our time slots are looking like in each day. The next schedule that is important is our block schedule. So throughout the semester, we have various blocks in different specialties. We've had oral surgery blocks, oral diagnosis blocks, graduate perio blocks. There's all sorts of things that just kind of pop up randomly, and it's your responsibility to check that block schedule and make sure that you make note in your own personal schedule when you're blocked where, because they'll pop up randomly and it's your responsibility to make it to those particular blocks. For example, this Friday, I have a block in oral surgery. We see emergency patients in the mornings. And so at the beginning of the semester, I went and actually wrote down in my book that I'm blocked off on December the 16th in the morning in oral surgery so that I knew there was no way I can make another appointment in that time slot. I needed to be down in oral surgery. And of course, the third major schedule is your particular schedule with your patients and their appointments. So we have all of our clinic times, all of our clinic slots available to us, and you can basically go in and slot in your patients however you need to. So at the beginning of the semester, I devised a system that worked really well for me, and it was basically taking a physical paper calendar and drawing out little red squares that represented our available clinic time slots. That way, anytime I was on the phone with a patient or texting back and forth with a patient trying to plan an appointment, I could quickly reference my little green book here, see where my red time slots were available, compare that with the chairs that were available in the clinic, and slot people in as needed. This was the best system for me. Some people print out our whole master schedule and they just write in their appointments in the various clinic block slot times, but for me, this was the most effective way that I found, and I came to it pretty quickly and just started enjoying it really a lot. So I think this is what I'll use moving forward. It's simple, it's easy to look at. I could get a very good overview really quickly of what my week's gonna look like, and I've just really liked that. I have colors assigned to all the different specialties, so I know at a quick glance what I'm gonna be doing throughout the week. I have operative, I have removable, I have peds, all these different things right there. And then further into the book, you can see the various appointments and like what I'm actually doing. I write down the patient's name, I write down their chart number and what we're doing together. This is also where I take my notes that I'm gonna use in the appointment. So every time we see a patient, we have to present our patient to the professor that we're working with, and we have to give them the vitals, the medications, any important med history, and then of course what they're doing. So I take all of those notes down here. It's also important for perio because I'm always writing down numbers and doing calculations. So I just have a place to kind of jot down all of this information. This is my little green book, and it has been super, super important for me. The next part of organization is patient needs. So when you get to your clinic, you have multiple patients that you're assigned to. I currently have like just under 30, trying to get that number down a little bit so that I'm able to focus in more on my various patients. But you need to figure out what each of your patients needs and then put it somewhere, put down that information. That way you kind of have an overview of what is exactly like in your port, what you have right now in all of your patients. Keep this simple, lay it out very simply, write down the patient's name and then put what they need. For example, if they need operative survey crowns, so fixed, and then a removable prosthesis, just write operative, fixed, removable, or RPD, or whatever it is. And that way you kind of have an overview of just what you have and what you're maybe lacking and what you need to kind of go out there and search for. And this point kind of brings me to my next point of the organization, which is where are you going to organize all of your information? For me, of course, my appointments are all here, but my various information about my patients and our clinical requirements is all found in my Notion. I keep it all there. It's the best way for me to organize. I know a lot of people that use Excel. That's probably a better way to do it in terms of just patient privacy and all of that. But I really like Notion, and I've found a really like aesthetically pleasing way to lay out all of my patients, all of their needs, the next appointment that we're gonna have together and what we're gonna do. And then also the next point, the next major point of my organization section here, which is clinical requirements. In order to graduate from dental school, you need to fulfill many clinical requirements in all the different specialties. Now, of course, every school is gonna vary a little bit in how many crowns you have to do or how many class 2 fillings, whatever the situation is. But you are gonna have a bunch of clinical requirements to complete in order to graduate. And it's extremely important to stay up to date with what you've done so far and what you need to continue to do in order to get to that point of graduation. For me, once again, I have this all broken down in my Notion. I actually pretty recently kind of finalized this for myself, and it was just sitting down with all of our different specialties and looking at what is specifically required in this specialty to get me to graduation, writing all of that down, and then going in and updating the things that I've done in this first semester. It's essentially like a progress report, and it gives me an idea of where I need to be looking next semester, the things I need to be trying to focus on, the competencies that I need to do next semester, the number of points that I need to have in various specialties. That is all broken down for me in my Notion, and I've absolutely loved it so far. It's the best way that I have found to organize it, but it's extremely important that you come up with some sort of organization system for your clinical requirements. I know a lot of people that use Excel, they just break it down all down on a spreadsheet, what is required of you and what you've already done. That's a great way to do it, and that's probably what I would recommend for most of you. All right, the next big chunk of this video is the clinical discussion. Now, I thought before making this video that I would go into a detailed breakdown about every single specialty and talk about what I've learned and the things that I've gone through. I don't think I have enough time for that, so I did want to hit on just a couple of the specialties, and as I progress forward in clinic next semester and next year, I can update you more on the different specialties as I kind of get into those a little bit more. The first specialty that I wanted to talk about is perio. Now, perio is In dental school, it's kind of similar to hygiene. In our school, we do all of our perio pretty much in our 3rd year. So what that means is you're basically doing cleanings for people. You are kind of becoming a hygienist, but you're doing it from a dentist's lens. So you're making sure that the things that you have planned with your patient in the future, the crowns, the fillings, the removable prostheses, these things are supported by healthy tissue. And so that's a good way to look at it. But basically, perio is a big chunk of what you have to do in dental school. And that is keeping all of your patients clean, performing infection control on all of them, and keeping track of just the various things that you have to do in this specialty. It kind of stinks from time to time. I won't lie to you. There have been days when I've had, cleanings or scaling and root planings and thought, man, I just wish I had a hygienist that could help me with all of this so that I could do the fun stuff and get into more fillings and more extractions and all of those things. But it is part of the dental school experience. It's something that we all go through, and you just kind of have to get through it. I did more perio this semester than any other specialty, which is good because moving forward, I'll be set up really nicely in perio, and I hopefully will get through all of it next semester pretty early on. So it's been good. It's just something that you have to look into, you have to stay on top of, and when patients come in the door with bone loss or bleeding gums, you know that you're gonna have a lot of cleanings on your hands and a lot of diagnosis to do. The next one I wanted to talk about was operative. Now, I made a video about my first filling, just sort of chronicling the experience, going into detail about the clinical side of operative that I was experiencing for the first time. I have really started to like operative. I think it's an interesting experience every time you go down to do a filling. I have had some rough days because of operative this semester, but I've also had some of my best days in dental school because of operative. It's very rewarding, is kind of what I'm trying to say. For me, doing operative in the clinic was the first time I really felt like a dentist, because that is an invasive procedure on someone when you're taking out decay and replacing it with something else that's hopefully gonna last for a long time. It's a good feeling, honestly, when you start to do it successfully, and I've really appreciated getting more and more of that as the semester has gone on. With operative, I think that we will all kind of get better with the more experience that we get. I think we do get a lot of it in lab in the first 2 years, but it's hard to really simulate placing a filling in the mouth in the lab because you have soft tissues, you have saliva, you have blood, you have all these things that you have to kind of work with in a patient that you don't get in a lab. My best advice for operative is just breathe. Take deep breaths. Don't let your appointments get to you too much. There will be days when it's absolutely kicking you. Then there are days, like I said, when it makes you feel really good. It makes you feel like you've accomplished something great. So stick with it in operative. Let's talk about removable a little bit. Removable prosthodontics is probably, for most people, the biggest hurdle in dental school, just because making dentures for people is tough. It is very time consuming. And it's, I think, probably the biggest thing that holds people back from graduation, just getting people into their new dentures and through that entire process. For me, I probably didn't do as much removable this semester as I would have liked to do. I did a little bit. I got started on some denture cases, and really it was just kind of getting geared up, but a lot of it was just learning how to do the process again. For me, I felt like we learned a lot in lab, but it was really hard to understand the process of making dentures for a patient when doing it in lab and when learning it from PowerPoints. It's taken actually seeing it in person on real live patients and seeing the process play out, understanding the reasoning behind the various appointments that we do in removable. That for me has been the way that I've learned a little bit more about this process. And it does scare me a little bit moving forward because I know there's a ton that I have to do, but I think I'm in pretty good shape, so I'm excited about that. Removable requires lab work outside of the clinic. This is something that I've learned a lot more about recently. I've kind of thought like, oh, I can just go about my days, schedule my patients, and then, the lab work I'll kind of do whenever I have time. You really have to put a lot of time into the lab work in removable. Setting denture teeth takes forever. It is a very tedious process unless you're just a wizard with wax, which I am not. So what I'm trying to say is you have to plan for this. You have to take time out of your days to put into lab work, and that does suck, but once again, it's part of the dental school process. The only other specialty I wanted to touch on was peds, the treatment of children, pediatric dentistry. This one for me was tough to come by. I didn't have any peds patients this semester, and we're required to have a certain number of points by the end of the semester. Thankfully, we can get points by assisting other students. So all of the points essentially that I got in peds this semester were by assisting my fellow students. And that was tough because it's time that you're having to spend on, not even your own patients just to get by in this specialty. But I have actually really enjoyed a lot of my experience in the pediatric dentistry clinic. Working with children is an entirely different experience. But sometimes it's actually like easier than working with adults because all children basically are confused and don't really know what's going on. And so you can kind of like talk them through it, generally speaking. But sometimes adults come in with 20 years of fear of the dentist and they're just completely shut off to anything. And no matter what you say or do, they're just like, I'm not loving this. So kind of, get out of my face. That being said, there's been some crazy experiences in peds. I've seen some pretty wild stuff in there, and it's kind of always a journey. So peds, something I'm looking forward to getting more into. I do now have some pediatric patients. I have some children that I'm going to be scheduling at the beginning of the year next semester, and we'll be getting more into that and just seeing how that goes. Let's talk about the next major topic of the video, and that is patient relationships. I have recently had a couple of patient interactions that have taught me a lot about getting to know patients and learning how to treat them well. First, overall, the major point is you are now in charge of taking care of other people, and it's an extremely important role that holds a lot of responsibility. It's the most important aspect of what we do. So in this first semester of clinic, I had the chance to start to get to know and build rapport with a lot of my patients. And generally speaking, it was a pretty great process. Most of my patients are awesome and have come to me looking for help and are very open to my point of view and sort of my diagnosis and are ready to go through the process. But there have been some that are a little bit more reluctant to sort of dive in. And in those situations, I've had to learn how to better communicate with patients, which has been very good for me. Sometimes you have to have a tough conversation with a patient. It's part of what we do as dentists, and if you can kind of learn how to do that in dental school, or at least get a head start on that, your time in private practice or wherever you go after dental school will be a lot easier. I think the most important thing about your patient relationships is being honest. You need to be honest with your patients. You need to be upfront. If you don't know what something is going to cost, or you don't know what the actual diagnosis is going to end up being, do not say to your patient, it's going to be this or it's going to be that, because that establishes sort of expectations in your patient's mind that then may change once you get further down the line. I can't tell you how many times I've had patients come in and I've said, well, it's pretty simple. We'll just do this and you'll pay this and then we'll get to that point. And then we get into the diagnosis, things change, and my patient's sitting there looking at me like, you told me it was going to be simple. Now we're looking at multiple appointments, a lot more money, and it just, you didn't prepare me for this. And the lesson there was, don't promise things until you're absolutely sure that they're finalized. And it's really important to do this. I guess it's not necessarily as much of an honesty thing as it is keeping information closer to your chest. And of course, being transparent with your patient. If you don't know something, just tell them, I don't know at the moment. We'll have to wait and see. And they can't fault you for that. A lot of times patients will pressure you to give them information about the timeline or the financial breakdown of their whole treatment plan and the big picture of everything. And to be honest with you, it's very difficult to do that oftentimes. So instead of giving them something that's false and establishing these false expectations, tell them, at this very moment, I'm not entirely sure, but we will get there, and I promise when I know, I will let you know. I think it just makes things easier if you approach it that way, because trying to back out of a situation where you've promised something and now you're not delivering it, that is much more difficult. So when it comes to your patients, try to build that rapport, try to build that trust, and just make sure at the end of the day that yes, you're here to go to school and graduate and get that diploma and that license, but along your way, you are affecting the lives of many people, and it's your responsibility to treat them the right way. The final point of this video is overall goals. So what is your mentality going into clinic? And people in school vary with this one. You know, everybody kind of has a different opinion on how to approach this. For me, my goal in clinic this year specifically, and just moving forward as well, was have a patient in the chair in every single time slot that's available. Now, this didn't always happen. There were time slots where I would, go home early or kind of take some time off. And that's totally fine, I think. But generally speaking, I wanted to get as much of my requirements done this semester as possible, so that hopefully by the time I get late into my D4 year, I'm not stressing about getting through all of these things, because I really stressed at the beginning of clinic to get them done as a D3. This is a mentality thing, this is a preference. I think there are people in my class that agree with this, a lot of people that kind of think this way as well, but there's also people in my class that would rather spread it all out evenly and sort of give themselves more time off throughout the experience rather than going all in the beginning and having a lot more time off towards the end. I think for you, just sit down and kind of ask yourself, what do I want out of these 2 years in dental school? Like, how quickly do I want to get through things? What are my goals? And that will kind of give you an idea how you should schedule your own patients and how much pressure you should be putting on yourself to get through. Because as much as I've said, like, I'm trying to get through as much as possible, there are people in my class that have gunned way harder than I have and have gotten a lot more done than I have. And they truly are like doing something in every single time slot and doing all of the lab work outside of school and never like using like clinic time to do lab work and stuff. And those people are of course going to be really far ahead. For me, I'm definitely more towards that end of the spectrum, but I'm not all the way there. I still give myself some grace. I still give myself some time because it is a tough experience. Clinic is stressful. Having all these patients is difficult. You have to do so much outside of just the dentistry. You got to find the happy medium, the balance for you, and that is the best way to go about it. So this video is super long. I know I've been just rambling on the entire time, but I did think that there would be a lot of interest in this topic because a lot of students get to their second year and they think, oh my goodness, in a few months, I'm gonna be treating live patients, and I just don't feel ready for that at all. I certainly felt that way. I think for me, it wasn't necessarily the dentistry part that scared me as much as the organization and staying on top of everything and just knowing how to get through the clinic, because it's a totally new experience. And at least in my experience, they don't give you a whole lot of guidance. They just kind of throw you in and they say, all right, go for it. And so there's a lot to learn. The first week we had of clinic this year, late in August, I didn't do anything. I just basically sat around and tried to learn, tried to figure out what the computer software was all about, tried to figure out how to schedule patients, what forms I needed to do every appointment, just the whole process. And of course, I wasn't able to learn it all at the beginning. I've been continually learning things, not even just about dentistry. Of course, you learn things about dentistry every day, but I've been continuing to learn things about the process at like in clinic at UTHSC every single day this entire semester. I come home every day learning, having learned a new thing. In other words, don't put pressure on yourself to learn it all in the very beginning. It will come with time. I say this about everything because it's true. Everything that's good and done right comes with time. That's basically everything that I have to say about clinic for now, but I'm sure I'll have more thoughts in the future about everything as I get further into it. And if you don't want to miss any of those, make sure you subscribe to the channel. Right now, I post content as much as possible at this point in school about my experiences in dental school. And if you don't want to miss that, please join the many people that have already joined. Subscribe, it's free, it's easy. And yeah, I think you might enjoy what's going on around here. As always, I appreciate the support. Thank you for being here, watching, liking, and commenting. I really do appreciate all of you, and it means the world to me. And folks, as I always say at the end of my videos, I will see you in the next one.